Actually, I injured my knee in high school. I tore my ACL and didn't require any surgery or anything like that. Just through a good rehab program and being around the right people, I was able to rehabilitate my knee without the use of surgery, and hadn't had any problems out of it since, even with 12 years in the military. So the rehab program worked. Probably the biggest thing is watching patients progress. It's just great to see them start at a low level and get to that functional level where they're up and walking and kind of doing things on their own again. It's just a really good feeling to be part of that process. Same thing, even with patients with the same diagnosis, no two people are the same. There's no cookie cutter answer. So it's challenging to come up with new techniques and new strategies to try to help people with their deficits rather than just a global kind of one size fits all type of program. Usually here we kind of get together in the mornings and decide who's going to work where. Most of us are assigned to floors. Depending on the caseload of that floor, some people may come help here or there depending on where they're needed. Then we go to the floors, and the physical therapist and I kind of divvy up the patients to that floors, who's going to see who and who needs what, and then we go ahead and just start treatments right then. So we dive right in the mornings and get started. Typically the physical therapist will evaluate the patient and then set up a plan of care, and it's my job to implement that plan of care. So depending on what the patient needs, I try to find ways to get them there. So as far as functional mobility, which is our primary focus here in the hospital, that can include exercises, balance activities, and things like that, just to get them up and get them moving and on their feet again. It can be easily used as a stepping stone onto PT school, and a lot of physician assistant schools are now looking for people with background in more of the physical therapy and athletic training because they have more knowledge of the human anatomy and how that side of it works and not just the medicine side. So it's a great stepping stone to get your basic knowledge of human anatomy and physiology.